Continuing on with case number 28. A 43-year-old man with HIV infection presents to the HIV clinic with multiple purple-red plaques and papules distributed across his skin. The patient says he feels fine and denies fever, chills, malaise, and headache. A complete blood count reveals his CD4 cell count is 180 cells per millimeters cubed. What is the most likely diagnosis? This is Kaposi sarcoma, an angiogenic neoplasm prevalent in HIV-positive patients. Kaposi sarcoma is caused by human herpes virus 8 or HHV-8, a member of the herpes viridae family. Members of this family are DNA viruses with a double-stranded linear genome in an enveloped icosahedral capsid. What important alternative diagnosis must be ruled out? An important alternative diagnosis for such skin lesions in HIV patients is bacillary angiomatosis, or BA, which typically presents with systemic symptoms such as fever, chills, and malaise. However, because BA is caused by Bartonella henselae, it is non-neoplastic and can readily be treated with antibiotics. How does the microorganism cause the characteristic discolored skin lesions? HHV-8 has a tropism for endothelium cells and is thought to induce vascular endothelial growth factor, which causes irregular vascular channels to develop in the skin. Red blood cells extravasate into these spaces, causing the characteristic purple-red skin lesions. What other skin lesions are associated with this microorganism? Kaposi sarcoma is not limited to the skin. The gastrointestinal tract, oral mucosa, lungs, lymph nodes, and other visceral organs may be infected. HHV-8 also infects B lymphocytes and has been linked to body cavity B-cell lymphoma, a non-Hodgkin lymphoma subtype, and to Castleman disease, a lymphoproliferative disorder that may progress to lymphoma. What other patient population is at increased risk for developing this infection? Transplantation patients who, like patients with HIV, are chronically immunosuppressed, have a higher incidence of infection than the general public. What are the appropriate treatments for this condition? Daunorubicin or Doxorubicin is the treatment of choice. Both cause DNA breaks by two mechanisms: one, intercalating into the DNA double helix, and two, creating oxygen-free radicals that damage DNA. A major adverse effect of their use, however, is cardiotoxicity. In HIV-positive patients, the first goal is to boost immunity by starting highly active antiretroviral therapy, which often leads to improvement of the disease. What other preventative health measures should be taken in this patient since his CD4 cell count is less than 200 cells per millimeters cubed? The patient should be started on trimethoprim sulfamethoxazole therapy for pneumocystis jirovecii, pneumonia, and toxoplasmosis prophylaxis.